Most people have noticed they get headaches when the weather changes, particularly before storms, and generally dismiss this as simply one of those things. But emerging research suggests that for certain individuals, particularly those experiencing severe migraines with specific characteristics, these weather-related headaches might be warning signs of underlying vascular instability that significantly increases stroke risk. This connection between atmospheric pressure, migraine, and stroke represents a largely overlooked aspect of preventive neurology. Let's talk about what happens physiologically when barometric pressure drops. Your blood contains dissolved gases, much like a carbonated beverage. When atmospheric pressure decreases rapidly, typically before a storm system arrives, these gases can form microscopic bubbles in the bloodstream. Simultaneously, blood vessels throughout the body, including those in the brain, respond to pressure changes by dilating or constricting, sometimes abnormally. These vascular responses trigger the release of inflammatory mediators and can alter blood flow patterns in ways that create the perfect conditions for both migraine and stroke. The critical distinction here is between ordinary headaches and migraines with aura. An aura refers to neurological symptoms that precede or accompany the headache, visual disturbances like seeing flashing lights or blind spots, numbness or tingling in the face or hands, difficulty speaking. These auras indicate that something significant is happening in the brain's vascular system. Research has shown that women under 45 who experience migraines with aura have a substantially elevated stroke risk compared to those with headaches alone. The mechanism appears to involve both the vascular instability that causes the aura and prothrombotic changes, meaning the blood becomes more prone to clotting. What makes this particularly concerning is that migraines are incredibly common, affecting roughly 15% of the population, so most people experiencing them won't have strokes. This creates a challenge in knowing who should be worried. The warning signs include migraines that change in pattern, becoming more frequent or severe, migraines that start occurring with aura when they previously didn't include aura, or migraines accompanied by neurological symptoms that don't completely resolve when the headache ends. These patterns suggest progressive vascular dysfunction rather than stable, benign migraine. Barometric pressure changes aren't something we can control, but we can monitor them. Numerous smartphone applications now track atmospheric pressure and can alert users to rapid changes. For individuals with concerning migraine patterns, keeping a detailed diary that correlates headache characteristics with weather patterns can help identify whether atmospheric pressure is a trigger. This information becomes valuable for both timing preventive medication and recognizing when a headache might represent something more dangerous. The medical response to this connection is evolving. Preventive migraine medications, particularly those affecting vascular tone like calcium channel blockers or drugs targeting the CGRP pathway, may offer dual benefits of reducing migraine frequency and potentially lowering stroke risk. Antiplatelet therapy is sometimes considered for high-risk individuals. The key is moving beyond dismissing weather-related headaches as trivial and instead recognizing them as potential indicators of vascular health that deserve medical evaluation, particularly when the pattern changes or intensifies.